So welcome everyone. This is the NDs of Color panel discussion. Today's discussion is on menopause. And the reason why we wanted to do this is because there are so many women, there are so many people who, you know, at the end of their menstrual cycles, as you get older in age, older in life, the change happens, the transition. And for some people, it is not a pleasant experience. So we wanted to make sure that we share some information, answer some questions, and give out the information that is needed to at least help somebody to not have to go through this transition in life in quite such a horrible way. Right? So before we go any further, I want everyone to introduce themselves. Let's start with Dr. Karen.
Hey everyone, I'm Dr. Karen Hurley. I am a naturopathic doc and functional medicine practitioner practicing and living in Seattle. Happy to be here today.
Thank you very much. Dr. Brandi.
Hi everyone, I'm Dr. Brandi Moore. I am in Scottsdale, Arizona, and I own a practice called Reclaim Integrative Health.
Excellent. And who's next? Dr. Farr.
Hi everyone, I'm Dr. Farr. I am currently in New York, so I'm in the East Coast. I got my degree, a doctorate degree and master's in nutrition in Connecticut. And I studied nutrition pretty much my entire life, and that is what led me to pursue holistic medicine, because I feel like we are such an important role in even conventional medicine. There's so much for us to offer, and we've changed so many people's lives. And I'm really excited to be here and to talk about menopause with so many brilliant doctors. So thank you so much.
Thank you. And Dr. Khadija.
Hi everyone, happy Sunday Fun Day. I'm Khadija Douglas. I am a naturopathic doc, also on the East Coast in Pennsylvania, Southeast PA. My practice is infinite wellness, and hormones are pretty much my jam, which is why I'm here today.
Excellent. And I am Dr. Turshá Hamilton. I am currently in New Orleans, Louisiana, and it is my pleasure to bring this panel to you all. So let's get started. The first question is, what is menopause? And earlier I was talking about perimenopause and menopause. So if you ladies could chime in and talk about menopause, perimenopause, whoever is first, you can talk about it. And then if anyone else has anything to add, just jump in. So what is menopause? What is perimenopause?
I'll jump in.
All right.
Perimenopause is a transition time that most women experience right around the age of 39. It's subtle around that age. But the period actually lasts an average of around 12 years, 10 to 12 years until menopause. Menopause is defined as the time frame where 12 months has elapsed since the last period. And once that happens, you have one day when you're in menopause, and then the next day you're postmenopausal. That's it in a nutshell.
Right.
It ain't that simple, but that's the definition.
Right. Right. Which is why we're having whole panel discussions about it. Anybody else have anything they wanted to add about it?
So I'll chime in. Menopause is a point in a woman's life where their hormones basically start to tank, right? You know, you have predominantly estrogen, progesterone starts to decrease lower and lower. And that's when all the symptoms start, right? But, you know, menopause is sort of a natural process in a woman's life. It's not a disease, it's not a condition, it's just, you know, hormonal changes that your body goes through. So obviously you're not gonna feel the same as you're in your teens or in your 20s, but it's important to start to prepare for it, to adapt to it, because you don't know how many women who are going through the process, perimenopause and menopause, and they're suffering through all these symptoms with no help whatsoever. They don't even know what to do about it, right? So that's why we're here, to help them guide through some of the, not desirable side effects of menopause. I know that typically, I think the average age of menopause is 51, if I'm not wrong. And that can change depending on what kind of lifestyle you've been living. It could be a number of factors, even genetics. I've heard that the age that you typically reach menopause could be the same as your mother's. So you can ask your mother, hey, what time period have you experienced this? And maybe it's better for you to prepare for that, So there's definitely a lot of factors that we can address for sure.
Thank you. And I do want to make sure that I repeat what you just said about it not being a disease. So many people will go through life thinking that their body is failing them, when in actuality it is just going through the transition with whatever resources your body has been given. So as you mentioned, that preparation process beforehand is important, because if you prepare properly, then you can potentially have less side effects or less symptoms. So what are some of the symptoms that you all know of? Like we know of the hot flashes that can range anywhere from just a little bit of heat to enormous heat. There's that. What are some of the other things that you all see in your practices?
I say, I've noticed women, can say, they'll talk about mood changes and they're not sure. And I think it's important that there's like this distinguishing or defining factor between, yeah, you are experiencing some menopausal symptoms. I think a lot of people always think it's just hot flashes and like no libido. But there's so much more. I was reading a really interesting article, and basically it talked about women feeling isolated, loneliness, sad thoughts. The weight changes are definitely going to be there as well. Started working with a new lady, and she's been noticing that no matter what she eats or how much she tracks or what she eats or how much she works out, but the weight has definitely been a huge struggle, and she's noticed that more than anything. So for her, that's been really prominent. And I think it's really just one of those things where it just varies body by body, and like you were mentioning before, what are your lifestyle factors previously could also kind of relate to the intensity or the severity of what you experience. Everyone's journey and transition is going to be different.
I'd like to piggyback off of that, because I feel like we tend to think of menopause being like, okay, it's that I've gone a year without my cycle and now I'm in menopause, but the symptoms can start really early. And as Dr. Hurley mentioned, that, you can start to notice things around 39. So you can get, a lot of those hot flashes. You're like, I'm 40 years old, I'm 42, I'm 43. This can't be menopause. The moods have to just be me, being grumpier. Another thing I notice a lot is the cycle irregularities that start to happen. And that can be, months without a period, or a lighter period than they're used to, or a month or two with a really heavy bleed where it's on and off with your period with really large clots. And I feel that when patients come in, they start telling me about that, and they don't know, like, oh, I'm 43. I don't know. My cycle's just kind of being weird. And really you're starting that transition. And oftentimes we think of menopause as like a destination, but as we've kind of said a few times, it's more of that journey. Symptoms start, and then there's things we can do as early as they start to make that transition smoother. Kind of the longer you wait, the rougher that journey can be for some people.
Right. We also have to remember that many women don't even have regular periods throughout their life. So that even makes it even more difficult for us as doctors to kind of figure out, okay, well, is this a typical cycle for you, or are you in the process of starting perimenopause, right? So it really takes great clinical skills to figure that out for sure.
Yeah, the end is never an end. Because as my colleagues said, the symptoms can go on even well into a woman's 50s, where she may have not had a menstrual cycle, as we defined earlier, 12 months with no periods, technically is defined as menopause, but hot flashes can go on well into a woman's 50s, sometimes even her 60s. Sometimes periods have to come back. They don't have to, they do. And all these things have to be obviously investigated in older women who've been menopausal longer. But yes, it's a journey that's highly individualized. Every woman's body is unique unto herself, and it's not a disease, it's a passage. And part of what I think our mission is in being here is to teach and redefine it as a passage that is actually a passage of empowerment. It doesn't have to be, you know, hellfire and brimstone. It can be a passage of empowerment too.
Let's talk more about that empowerment, because a lot of women are or feel disempowered, you know, feel helpless because, you know, you're going through this process, you have, you know, you're walking down the street and all of a sudden the heat just descends upon you, or, you know, all of a sudden you can't predict when your cycle is, or all of a sudden you're biting someone's head off and you just feel like things are going awry. How can you help, what can you say to help people understand that it is more of a, you know, a passage, a transition, an honor to be able to go through this process?
Docere. I think for me, I see a lot of the like early 30s transitioning. And so I think the earlier that we can start educating our patients, the better. Just like I always tell patients, like having terrible, painful menstrual cramps is not normal. So I think if we can normalize that transition to menopause, just like we're trying to normalize normal period cycles, I think it's always going to be better. And that's that whole docere, physician as a teacher. And I think that's the great thing about what we do as naturopathic doctors, is being able to have those longer visits, getting to know your patients, to be able to say, hey, like, this is what could be happening. This is what could be happening with your body, but it's not a bad thing. You should look at it and be proud of your body going through this another change in your life, badge of honor. So I would say docere.
Okay.
I have some patients joking around and saying, oh my gosh, I can't wait to go through menopause. I don't want to have a period anymore.
Yeah.
It's like, there you go. That's the silver lining.
I think it's also just letting people know they're not alone. So it's educating, like, hey, these symptoms are coming. But when you feel that isolated, I'm moody and no one understands, no one else is going through this, my girlfriends aren't talking about it, it's knowing that, no, it's not just you. Lots of women are going through the same thing, and that there's also help. There's an answer. Or there's you can ease the transition, because sometimes that fear, that feeling is just that aloneness, and that, is this how my life's going to be forever? And it's like, no, this is, like we said, a transition, your journey where you're going to go into your next phase, and we can kind of help you take that journey as smoothly as possible.
Absolutely agree with everything that's been said. The mystery of it all, I mean, that women's bodies are going through these changes that are very alarming, and they don't know what the hell is happening to my body. And so having that guide, someone to talk to teach them about what it is and how to help and how it can get better, is definitely empowering. But the other piece for me is when a woman goes through, especially the later phases of menopause, aging happens, and there's this tendency to think of their bodies as less than, as, not as empowered as they were before when they were younger and not going through this process. And so for me, it's about, I personally enjoy, I know my patients don't always appreciate my perspective on it, but I think that women are often not in their bodies. And so when they're having hot flashes and all of a sudden they have to feel their bodies, they have to start to think about their bodies and themselves differently, as entities onto themselves. And I personally think it's great when a woman can be bitchy if she's never been bitchy before, you know? And so in that sense, I try to turn some of these negative, crazy making symptoms into empowering ways to see maybe taking on characteristics and embodying ways of being that they didn't have access to before because their bodies weren't shifting. And so that's what I try to do with my patients, especially the ones who are older and feeling really negative about it.
Thank you. Thank you. Because I actually had never had that that perspective. I've never heard someone, you know, look at it as, you know, being empowered and like experiencing what your body is going through at that moment. So thank you for that perspective. Risk factors during perimenopause. What are some of the things that can potentially be either problematic? Let's talk about that. Like, are there any things that are permanent when like perimenopause? We talked about it being a process that can last, you know, 10 or more years. Are any of these things permanent? Actually, I just thought of the vaginal dryness. That is one, and that can be permanent. So, because we know like the hot flashes, they feel like they're going to be permanent, but they eventually subside. Do the mood swings tend to subside, or is that something like the vaginal dryness that just continues on?
I think it depends on treatment or what you are doing for it. Because there's certain treatments that work faster than others. Others take a while. Like herbs are going to take some time, and they're going to treat different symptoms compared to like hormone replacement therapy. Mm-hmm. At least that's what I've seen. But I would say in regards to symptoms that last, that loss of skin elasticity, people tend to notice. The like breast changes in the sense of like losing that skin elasticity, losing that like youthful, and I mean that in a positive way, but kind of like that plump fullness that people tend to notice. That can kind of last. The weight changes or like the difficulty losing weight, that can be something that you really have to work through or work at. Whereas before it could be like, oh, I could eat a cheese pizza and I was fine. Now that cheese pizza will stick around a lot longer. You feel like you have to watch what you eat more. So I would say there's definitely some things that are more adjustments that you'll have to make compared to other things, or like hot flashes will come and then you can stop the hot flashes. But some of the other stuff you kind of have to work a little more.
Did anyone have anything else they were about to add?
Well, I don't think anyone talked about how like the dip of estrogen affects the other parts of your body as well. Like for instance, like the risk for osteoporosis is something that we should definitely be concerned about when it comes to menopause. This is something that I think that a lot of women think it's rare, it's not going to happen to me. But then when it does, it's like, oh my gosh, now I have to really kind of nip it in the bud and figure out how to kind of reverse it, right? So it's more difficult to reverse disease than it is to prevent it. So, you know, depending on the situation, you know, and basically different kinds of nutrients and therapies, that I never think that things are permanent. You know, you can always help it, improve it, reverse it. So that's where we come in, and there's definitely different therapies to kind of help improve those symptoms.
I'm gonna just quickly piggyback off of Dr. Farr and triggered something. So just like we have to be cognizant of risk of osteoporosis, you know, we also have to think of estrogen declining and the positive effect that estrogen has on heart health. We typically do tend to see the correlation of cardiovascular events in postmenopausal women. So I would say, you know, if you have women who are going through perimenopause and do have a history of cardiovascular disease, you definitely want to be planting that seed already and addressing those issues because of the positive effect that estrogen has on your heart. So sometimes I always, you know, people say, I hate my period, I want it to go away, but I'm like, it's protecting your heart. Like, come on, we'll fix your period, but it protects your heart. So I guess that would also be something to look for in folks and females who do have a pre-existing history or family history of cardiovascular disease because of the decline of estrogen.
Thank you. Thank you. So let's talk about some of these effects of going through the menopausal process. Weight gain. That's a big one for people, no pun intended. That's a big one. What can she do to sort of help that process along?
I think the main thing women who are in menopause, late menopause, and postmenopause have to do is to maintain muscle. I think it's one of the first things that really starts to change. Muscle mass changes a lot as hormones decline. And so the more muscle you have, the more metabolic resources you have to burn fat. And so I think a woman should be trying to do whatever she can to maintain muscle. So strength training is one thing that I think needs to be part of a woman's repertoire for exercise, to maintain muscle mass, to help reduce the weight gain. There's going to be some, it's really difficult. I don't know about you colleagues, but most women do gain 10 to 12 pounds, 10 to 15 sometimes, maybe more. It can go, but the more muscle mass she has, the better the weight loss, or the body composition tends to be improved, in my experience.
And going through coronavirus quarantine is not helping that situation.
Not at all.
So you have your quarantine 15 and your perimenopausal, however many. Yeah, so
double whammy.
Yeah, exactly. Exactly. So that actually brings up a great point. Thank you, Dr. Karen. So the maintaining muscle mass will help the weight changes, but it'll also help keep the bones stronger.
Yeah.
And the exercise will also help with the heart strength, the cardiovascular issues. And then we have just all the other things, making you feel better and hopefully helping to improve your mood. So, just that one simple thing, we say simple, but it's not always simple to actually go and do the thing. But this one simple thing just touches on every single part of it.
Yeah.
What are some other things that people can do? Like, what other kinds of workouts? Is it just exercising with weights, or is it all exercise just in general?
I think there's better exercises for the individual, right? Like, some people do really great with high intensity and love it, and there's others that you're more prone to injury. Your body, you can also use as weights. Right now, I know people are at home. You can use cans, you can use water bottles or gallon jugs. Like, it doesn't necessarily have to be, I'm going to the gym and hitting the squat rack. If you can do that, that's awesome. And I 1000% say go for it, because it is going to help with mental health, especially during this time. But you can get resistance bands. Yoga is a great strength training. It's not high intensity, so you still want to add in maybe some like low steady state cardio or something else to get the heart rate up. But yoga can be a great strength training as well. I feel like Dr. Khadija had some other ideas too.
No, exactly what you said. It's very individualized, because some people don't like the high intensity, but yoga is great. Strengthens your core. That's, people struggle with core. And I feel like if you have a strong core, and it just helps overall. So I think it's just going to be very individualized, and what works for the person, and what they enjoy.
Exactly. I mean, if you're not enjoying what you're doing, most likely you're not going to be consistent with it, right? So half the battle is really just doing it, right? Getting up and moving every day, stretching, and the movement is important, because as human beings, we have to constantly move around to retain our flexibility and to retain our muscles and everything. So I think that's the first part. If you have legs, you can walk. If you got arms, you can do something, right? So something is better than nothing. That's, yeah.
Yeah, never underestimate the power of walking. I mean, it's the first thing we learn how to do as humans, little humans, is we walk.
Right.
So just doing that helps. It all helps.
So Bernadette mentions she walks, hikes, and swims, not much strength training. Definitely a variety there, and definitely still getting some great exercising. So there's that.
She's doing weight bearing. She's swimming.
Yes.
You know, she's pushing water that is heavier than our mass out of the way. So that counts for sure.
True story. I'd actually gotten a few questions that I want to make sure that I ask. A friend of mine actually asked, how can a significant other support women going through menopause, perimenopause? Because, you know, we have a lot of people who are next to these women, and they have to feel, you know, the effects of it. How can someone support her?
That's a great question.
There's sorry.
No, go ahead.
Some of it is just them knowing what you're going through. Some of it is you sharing, hey, I'm having a hot flash, and when this happens, this is what it feels like, and I need to take a minute. Or I might be shorter with you in this regard. It's not you, it's something that I'm going through. And if your partner truly understands, sometimes that can make it easier for them to accept. I know menopause and pregnancy are different, but when I was going through pregnancy, same hormonal shifts, it was like all of a sudden you were like, I can't help it, something's coming, and you just wanted to go off. The minute I went off afterwards, I was like, I'm really sorry, I don't know what happened. I'm not that upset, but it's the communication. I would think her communicating her needs and then them communicating how they can help, but also what they need from her, which might be just that openness.
Dr. Farr, were you about to say something?
Well, I'm not sure if this is medical, but personally, I think that partners can do so much for their significant others in regards to, like you said, Dr. Brandi, that empathy is very important, you know, just to understand that they're going through something difficult and just to be understanding, you know, and be respectful of that process. Also, I just lost my train of thought. But, you know, especially like when they're going through those mood changes, or if they're going through sleep disturbances or whatever it may be, you know, to try to like comfort them in ways that they want or they need, you know, and also to tell them that, hey, listen, like you're going through this, you're still a strong person, you're still beautiful, you're, you know, you have an amazing personality, to kind of like, you know, give them words of empowerment and encouragement that they can go through this. So it's sort of like an easier burden on them. I feel like that's great.
Thank you. I think that's important because I've heard a lot of women who, you know, go through different phases in life and they lose confidence because of these shifts. You know, they see their body changing. It's not the youthful body that they used to have. It's not functioning the way that it used to function. And so they start to have like a different viewpoint of who they are. And it's not always positive because I'm not that person anymore. So, you know, that empowerment, that encouraging, that, you know, I still see you as a beautiful person. And, you know, those things I believe are going to be very important, especially if you know how she likes to be encouraged, you know, speaking the language that she can hear. If you say something that she's not accustomed to hearing, that might not go over so well. But if you've paid attention to her over the years, then you know how to encourage her so that she receives the message and it actually works to help her not be so hard on herself. So thank you for that. Anyone else?
Yes. I would add that Yeah, I agree with all of you. The thought that I had was, if a partner is not getting what your experience is, it's important that, in my view, that a woman gets validation from others going through it. So if she can't quite get it from her partner, then making sure that she is in relationship with a doctor, a colleague, one of us, or there are lots of ways to connect to women online who are going through this, that they can get that validation and that support from. And many times women have wonderful ideas about ways to help other women communicate these things to their partners. And when they're not perhaps stepping up in a way that's being validating and empathizing, as Dr. Farr put it. So women need women, connect with other women to get the validation, to get the support you need, and the language maybe that you need to go back to communicate to your partner what your needs are. Sometimes also a woman doesn't even understand herself what's happening. And so that's where we can help. We can explain, this is what's happening biologically, and she can get it so that she can convey it.
Thank you for that. Thank you for that. Because I'm actually learning this lesson, relearning or learning how important women are, to us in every stage of life. And so just having that reminder of, contacting your sister friends, contacting your female doctors, contacting your elders, and talking to them to find out what they went through, what they're going through, just kind of giving that encouragement will definitely help. This was actually a male who asked the question. So, he was trying to figure out how to support his wife in this process. I don't know if she's currently going through it, but I thought it was a great question. So, thank you all for your responses, and hopefully he's watching. I hadn't seen him jump on. But I think that'll be great help to help her, get through that. And, even to remind her, talk to your friends, talk to your family, because that is important. I want to move back to something we talked about earlier. Several of you mentioned about preparing your body before you go through the process. What are some of the ways that a woman, a female can start to prepare her body even prior to experiencing any of the perimenopausal symptoms? I see lots of thoughts.
Well, we've talked about exercise.
Yes.
So I feel like having an exercise regimen ahead of time is great, just to make sure you're not losing that muscle mass, which is going to help, burn fat more effectively. You're not losing that bone density, so it's preventative in that way. You're also building up that cardiovascular health. So those are really helpful, just from what I know we've talked about.
Yeah.
Dr. Khadija?
I would say taking a look at nutrition, and that's always going to be important. What are we eating? There's going to be foods that can offset that hormone imbalance. And so I would say that would be a great place to start. I'm always a huge advocate of veggies with every meal if possible.
I didn't hear the last thing you said.
Oh, I'm always an advocate. Can you hear me now?
Yeah.
Yeah.
Always an advocate of increasing those greens, leafy greens, cruciferous, spam, to support the body. So I would always say take a look there. That's always a great place to start, no matter really what condition, because you always can get a win there. I love the idea of the exercise, of course, right? That's going to be cardiovascular health. Then I would always just say maybe just taking a look at other organ systems that could mimic what some of the perimenopausal symptoms could be. So I would always say, take a look and see what your thyroid is, because that could contribute to why a woman is struggling with her weight. She might be thinking, oh my gosh, is this the perimenopause weight struggle, or is this because my thyroid is, like, where are we at with that? That's always an ideal place to start, because thyroid controls tons of things. So that could be something that you can consider as well.
Thank you.
Yeah.
Dr. Hurley, were you about to?
Yeah, I was just riffing off of what Dr. Khadija just said about thyroid. It made me remember that women's adrenals need to be supported too, because the adrenals are stress glands, and I just don't know any woman who hasn't experienced a great deal of stress leading up to menopause. And so managing stress could be a whole nother topic, but that's a real big part of, you know, how is she going to express menopause? You know, her stress, if she's been under chronic stress in her, you know, 30s and 40s, then menopause is going to be rough. So having places for women to manage and discuss their stressors and get help will help what she's doing nutritionally and what she's doing with regard to exercise.
Well, let's go ahead and delve into stress, because as you mentioned, the adrenals are important. And for those of you who don't know, when you're, when you go through puberty, your ovaries take over the job of producing the estrogen that your body needs and uses. But once you go through menopause, perimenopause, your adrenal glands take over the job again, right? And if you are stressed, if you have been stressed, then your adrenal glands have been overworked for however many decades. And now you're asking it to pick up a task that it hadn't done since you were, 10. And so if you, like she mentioned, if you were going through chronic stress and you were not supporting your adrenals, then you can have a really big, start to have really big fluctuations. So let's talk about the stress part of it. What are some ways that you talk to your patients about handling stress, recognizing stress, and what do they do about it?
I feel like the recognizing stress is a tricky one, because oftentimes they'll list off their laundry list of things, kids or husband or house and job and pets and everything. And then you ask, well, what's your stress on a scale of 1 to 10? It's like, oh, I'm not stressed. I don't know. I don't feel stressed. But I think we tend to block it out. Or think that if we're stressed, it means we have panic attacks. Like, people think, oh, I'm stressed means something extreme is happening, when really it can just be like a subtle nagging in the back of your head. So I kind of see where they're at, right? Some people are very open to things like meditation, and some people are not. Some people feel like exercise really gives them the endorphins that they need and they feel so much better. And some people will say, it's a good workout and I sweat, but I don't feel anything. So I usually recommend, based on where they're at, but meditation, journaling, 4-square breathing or deep breathing, yoga, Tai Chi. I try to see what they're open to and then give it options and see what they take, what resonates with them.
I know many of the females that I work with don't even know that they're stressed. So sometimes I have to break it down for them. So I'm like, so you went to work today, your boss got mad at you, someone yelled at you on the phone, then you drove to me in traffic, the person in front of you was driving like an idiot, and then you had to do a huge U-turn to get into the office. So tell me how you're feeling now, right? And I'm just like, and your cortisol and cortisol and cortisol. So once they kind of understand that just little day-to-day actions can cause stress to increase, then they take a step back and they're like, oh, wow, maybe I do have a lot on my plate. I'm, soccer practice, baseball practice, making cookies that are gluten-free, dairy-free, grain-free, rice-free, because all the kids have allergies. Then I'm going to the PTA meeting, and then I'm like, yeah, tell me more about that. So I think sometimes you have to really just get to their level and be like, you have stress. Because a lot of people will be like, no, I'm not stressed. We're living in a pandemic, friends. You have stress, okay? So sometimes just really having them understand what stress is, and that little day-to-day actions and effects over time, if we aren't addressing it, can totally tip the scale in a negative flare. So I think starting there, and then obviously implementing all the great things that Dr. Brandi said, like Qigong and Tai Chi and the breathing, can help as well. While they're in traffic, breathe, you know? Yeah. So start there and then add those great recommendations.
I want to add to your list before you go on, Dr. Farr. I want to add to your list, sleep. Most people are not sleeping, especially, you know, during the pandemic, but just in general. They're not getting very much sleep. They had all that work to do at work. They brought it home, and after they put everybody to sleep, they stayed up a couple of hours to get it done. When they did go to sleep, it wasn't restful sleep. And then the alarm woke you up. So now you wake up in a jolt from not getting much sleep. And then you go through all of that stuff all over again. So tell me you're not stressed. All right.
Tell me you're not stressed? Okay, I'll wait. Mm-hmm.
Yeah. All right. Dr. Farr, what were you about to say?
What you were saying, like high functioning on 4 hours of sleep, right? Like, so what I was going to say was piggybacking off of what Khadija was saying, Dr. Khadija. So the stress, like people, isn't it interesting how people manifest their stress? Like first off, they don't even like recognize that they have it. And then other people, they just like explain it as an uneasiness or discomfort or like nervousness, you know, these are all kind of like mental forms of stress. And how they cope with it too, right? So like, what do you do when you're feeling overwhelmed? Are you going to go out and clean your entire house, or are you going to go and kind of like sit there, like pondering about things? Like, so different people express it differently. So it's very interesting how that happens. But, you know, stress comes in so many different levels too. It's not only just like mental stress, there's physical stress. Basically, if you're in America and you're going out and you're listening to the news, or you're drinking the water, or you're breathing the air, it's like almost everything in your life is a stressor to your body, right? So recognizing that and recognizing that there's, you know, you can do something every day to kind of like improve your quality of life, so you're not so stressed out all the time.
Absolutely. Dr. Hurley,
Yeah.
do you have anything to add?
Yeah, I think everything that's been said is absolutely true. How people just are in denial, like how they really don't understand that their bodies are absorbing stress on a day-to-day basis. And then there's the stressors that happen. What we've been talking about are the sort of in your face stressors that we see as physicians and hear and can reflect back. But then there's the stressors that perhaps some people experience, you know, as children, you know, growing up in difficult childhoods, or if they were homeless, or there's so many backstories to people's lives that they carry with them, that they deal with the best way that they can, that can also contribute. And sometimes having these one-on-one conversations in intimate spaces that we create as physicians with folks, these things bubble up, and we get to say, hey, you ever thought about talking to anybody about this? Just to Dr. Brandi's point earlier in our conversation about how menopausal women a lot of times experience a lot of anxiety and depressed mood. I mean, it can be major, and things that can bubble up during this time, like childhood traumas and stuff that they've never talked about or dealt with. These things can come up, and we can say, you can go ahead and get support. We give you permission to get counseling or consider therapy if you've never thought about it. These things really matter, and can also help them manage their emotional stress, for sure.
And I want to make sure that we don't, you know, forget to mention that people of color also have an additional layer of stress. You know, of course, some more than others, depending on the situation that you're in, the neighborhood you grew up with, the family structure that you have, the culture that you were raised in. the business that you're working in, you know, the aggressions, the microaggressions, which are huge, it also adds another layer of stress onto all of that. And so, you know, I wanted to make sure that we did not forget to mention that part, because that's another thing. You know, being female in this country, well, in the world, is another layer of stress. You know, just not having control of your reproductive rights, not being allowed to I was thinking experience pain, and I was thinking specifically about a conversation I had before, you know, how women will go into the hospital with labor pains or whatever, and they're being told, oh, you're not in pain, or that's fine, that's normal, you're just hormonal changes, and people ignoring you. So, you know, just know that there are layers to stressors that we all go through, and it absolutely affects every part of your life, especially and including your menstrual cycles and the transition from having regular menstrual cycles, or whatever your menstrual cycles look like, into menopause, perimenopause.
Yeah,
I agree. Dr. Turshá, I was going to say exactly the same thing, that, you know, people of color have way more anxiety and stress than probably anyone else, because we have to carry the burden of so many levels of society, right? You know, not having the same kind of rights as other people, or, you know, going to the medical, like, healthcare system and being turned down, or being felt like you're not being listened to, right? Or someone downplaying the level of pain that you have, or saying that, oh, you know, women of color have a better tolerance for pain, so you don't have to worry about them. So it's like all these things that we have to deal with, that, you know, we have to fight for our right to experience the things that we're experiencing and to be heard.
Yeah, and it definitely does not help. So you know, make sure that you are examining how much stress you're under. Drop your shoulders. Like, if you're watching, drop your shoulders, right? Like, all of us did the same thing. But throughout the day, drop your shoulders. You'll notice that your shoulders are up there. All of us had our shoulders up here. And we're doing something we love. So, you know, if your shoulders are inched up here at any point during the day, and you have to tell yourself, drop your shoulders, you're probably under some level of stress that you're not even realizing, because your shoulders are just creeping up, right?
Yeah.
You know, take a deep breath, and everybody's about to do the same thing, right? Take a deep breath. Most of us are breathing very shallowly, because we've been trained to do it, because we're not paying attention, and because of chronic stress. So, you know, all of those things are sort of indicators about the stress level that your body is going through, that you may not even realize it.
I also want to just add that a lot of times in our communities as well, saying things like, I'm going to go see a therapist, or I'm going to go talk to someone, is not as acceptable. So we tend to bottle things up even more. So part of it is the stressors outside, but part of it's that internal, like, I can't look weak. I know that was something that I dealt with a lot in the past, but it was like that weakness that you have to present your world. I can carry everything on my shoulders, but ask for help. And then, you know, talk to someone, whether that's a friend, whether that's a therapist or a psychiatrist, or someone to get you to where you need to be. Because as women, even, we tend to have that, you know, in an airplane, when the mask comes down and they say, put the mask on yourself before you help someone else, we tend to never do that. Yeah. We tend to take care of everyone else first, and then us last. And we'll ignore all of the symptoms that our body is giving us throughout our 30s and 40s. And then all of a sudden it's like, oh, I'm in menopause, and now the world's on fire. And it's a lot harder to get you back from that than had you noticed it, you know, 5 years before that.
Yeah. Dr. Williams says people of color are really in denial about their stress. We feel like we feel like what we endure on a day-to-day basis is normal. And it's not. It's common, but it's not normal. It's not what's supposed to happen. And, you know, you think you're going to get through the situation, and then once you get through the situation, it's done, but it really does affect you long term. It sets you up for everything else that goes on in your life. So this is why we're saying make sure that you're actually recognizing that you're under stress, and then start to do some of the things that you need to do to mitigate some of that stress. Do you guys have any other recommendations of ways that people can start to really handle that stress better? I know the breathing exercises are huge because people can do that anywhere, and most of us are not breathing deeply anyway. What else? What are some of the other things that you all recommend?
I think Dr. Farr had mentioned it, identifying what you turn to during moments of stress. So for me, back in the day, it was birthday cake. That was what I would turn to. I love eating cake. So I think if we can identify, okay, well, when this person cuts me off in traffic, or when I get a phone call from this person, it causes me to be upset. So I pour a drink, I go to the slots, whatever that is. I think starting there, and then how can we shift it? So when you see that number on the phone, can you let your shoulders go? Can you take a few deep breaths? Can you go for a walk? I would say, just once again, I'm always like, take it a step back. How do we get to that spot? So identifying it and then finding new ways to deal with it. So that would kind of be where I would start.
Okay. Thank you.
Yeah, I agree with Dr. Khadija. You can't fix a problem you don't know that you have, and identifying that you're an emotional eater can make you know, like, oh, I'm mad. Oh wait, do I really want these chips, or am I just stressed? Should I go journal instead? That can really identifying. I agree with everything she said.
Thank you.
Agree. And I would say practice self-compassion.
Yes.
I think that women are particularly hard on ourselves. We are just really taskmasters, and we can speak to ourselves in ways that are very downgrading, and we don't even know it. We have these internal dialogues and monologues even that are just designed to take us out and make ourselves wrong all the time. And so it's sometimes hard to know that you're doing it, though. And so I would say that it's important to speak to a trusted companion or friend or girlfriend or pastor, or just someone that you can reach out to and say, I think I'm having some thoughts that maybe not so great, and just help reflect back in a way that's compassionate and empathetic if there's support that's needed. Sometimes it's just hard to see what you're doing, and having someone in your community that you can touch and reach out to for healthy self-reflection, I think, is a good thing.
Thank you. Let's talk about, Dr. Farr, were you about to say something?
Oh, I'm just going to agree, that we all have felt down at some point or another, right? I mean, I definitely have felt that and reached for a bag of cookies and finished it because I was, feeling a little bit down. But there's always, things that you can do. Like there's always help. You don't have to feel like you're alone. So sometimes what empowers me or kind of like lifts me up is I'll put in some like motivational speeches, or like look up something great on YouTube to tell you that, sometimes you need a reminder that, hey, like, why are you feeling this way, right? That you're stronger and you can get through this, and this is only a short period of time, and then you realize what your worth is. So don't be afraid to kind of lift yourself up whenever you need it.
Excellent. Excellent. One of the things that we can start doing is actually recording our own voice, saying positive things to ourselves, so that not only are we changing that internal dialogue, but we're hearing ourselves speak to ourselves in that positive way. I think that'll be huge to help some people. I want to talk about hormone therapy. When I was in school and I was introduced to hormone therapy, my initial reaction was that, was a negative reaction. Why would we prescribe hormones when so many people's hormones are out of balance in the first place? You're just adding to the problem. But I've learned that there is a proper way, a good way to actually add hormone replacement therapy to a situation, to a person, so that it's less harmful. It's not just throwing hormones on a person and not, and that's it, that it can actually help, be healthy and helpful. Can you guys speak to hormone replacement therapies? Why do you prescribe it? Why do you like it? What is a good way to have it prescribed? If a woman wants to do it, what can they look for or ask for?
Hormones are great.
There you have it.
I think my colleagues agree. I learned, like you, Dr. Turshá, that when I was in school, I was like, no way am I going to prescribe hormones. They're bad, they're evil, but now over time, I've come to understand better how important and how preventive, actually, hormone replacement therapy can be. And for many women, it's the only thing that helps, especially with the most disturbing symptoms for a lot of women is the hot flashes. And herbs, we have lots of training in Western and some of us Eastern herbal medicines, and we can prescribe these formulas, and a lot of times they work really well until they don't. And then thank goodness for hormone replacement therapy, because it works and it's protective, and it has to be done and calibrated. We were saying earlier how every woman's body is different. Every woman's body is unique. How she expresses hot flashes from one to the other can be really varied. And so you have to calibrate the hormone prescription to that body. But it's a wonderful tool to have in our armor, in our basket of tricks, and I use it daily for a lot of my patients.
Yes,
I have sort of a question. I'm certainly not the hormone expert, but I know that there's differences between conventional hormone replacement therapy and something called bioidentical hormones. So if anyone knows more, wants to talk more about that, you can.
That is actually a great question. What is the difference between, regular hormone replacement therapy and bioidentical hormones?
So the hormones that if your conventional doctor were to prescribe Premarin, is the synthetic estrogen that's most common, and that is derived from horse urine, hence the name Premare. And so our bodies just don't recognize it as our estrogen. We tend to build it up. We don't process it as well. And it can make you more susceptible to things like those estrogen dominant cancers, breast, uterine, and ovarian. With bioidentical hormones, typically it's going to be made from a plant, but they're more identical to our hormones that we produce. And so we are able to utilize them better. We're also able to excrete them much better. And so the risk for causing those estrogen dominant cancers is lower. It still does have to be monitored. So usually if I have a patient on hormone replacement therapy, the options that I tend to go to are either a troche, which is like a lozenge, you just dissolve it either in your cheek or under your tongue, or like hormone pellet therapy I use a lot of. And they're produced or processed in our bodies differently, but they're both bioidentical. And then I monitor with labs. So we're doing frequent labs to make sure we're not transitioning from estradiol, which is one of the safer forms, one of the more active forms of estrogen, to estrone, which is going to deal more with some of those hormone dominant cancers. And then making sure that basically I'm giving you these things, they need to stay these things, and you need to process them well, and they don't need to convert to other things we don't want. So it's a lot of labs, and I use bioidenticals personally.
And I heard they do wonders for patients too, symptomatically. They feel so much better. They feel like their mood has stabilized. They feel more youthful. They feel like they don't have the, you know, like the memory issues. So it actually like, to control some of their like unwanted symptoms, bioidenticals, and also the, what is it called? The
pellets.
Pellets, sorry, yeah. I've seen it done. I just forget the name. But yeah, so they work really well. And I worked at a practice where there was a bigger scope in California. So women were also doing, including, in addition to estrogen, they would also do progesterone creams. So those, they have some benefits too in preventing some of the unwanted cancers as well. So
I'll say if you are on estrogen therapy, you have to be on progesterone, because then those need to be in balance the same way they would naturally be in balance if you were producing your own hormones. So oftentimes the estrogen is given with testosterone, because that also decreases in women as we age, in the morning, and then progesterone is given at night before bed, and that also helps with sleep. So it helps with sleep, mood. Basically, when progesterone gets too high, if you think of a lot of PMS symptoms, that's when that happens. So like the bloating, the mood swings, all of that stuff can happen. So you always want to give both. Get both if you're a patient.
Thank you.
Mm-hmm. And you want to get with a practitioner who knows her hormones, like we were just hearing from. You need to work with someone who really understands them. A lot of docs don't. It has to be individualized. That's the other piece that I hope people understand. It needs to be calibrated to your body. And an experienced doctor who understands that will do that for you.
Also say from a patient perspective that hormones do resolve a lot of symptoms, but because like Dr. Karen was saying, it is very individualized. So the dose you start on, you might notice that they're better, but it's not gone. Or, you know, you could do labs and you've overshot the mark. Okay, now we need to kind of drain your estrogen or whatever, get you more in balance, and then try a lower dose. Because everyone not only feels good at a different level, but they also process the hormones a lot differently. And if diet's not on point and bowel movements aren't on point, all those things, you might be someone who needs a much lower dose than someone else. Or if you smoke or are very active, you burn through those hormones a lot faster as well.
So let's talk about poop. Why is that important? You know, because of course, you know, poop was coming. So
I was waiting for it. I was ready.
Yes. What's that? So, you know, poop is going to be a conversation that comes in on most of these naturopathic talks. But why is it important here? I mean, I know, but I want to hear you guys talk about it.
Mm-hmm.
Dr. Moore, you go ahead since you brought it up.
I was going to say, I feel like I've talked a lot, so.
I want to talk about poop. Dr. Khadija, you take that one.
Poop is important, team, because you need to get rid of these excess hormones that are just hanging out. So we love hormones. All of us can agree that we love hormones. We love it, that right balance, but they have to be eliminated. It gets bound, you know, we break it down through our liver, it binds through fiber, and that gets removed through your GI tract. But if that process isn't happening and you're not having regular bowel movements, it starts to build up. So you need to poop, team. Pooping is important. Pooping helps with hormones. The end.
I'll also piggyback to make people even more encouraged to poop, that when you aren't eliminating your toxins, they can be recirculated, and your body's not dumb. It wants to protect your health and protect your life. So it will store it in fat. So if you want to lose weight or keep the weight off, make sure you're pooping, because if you don't, then your body's going to pack on more fat in those unwanted areas so that it doesn't harm itself. So go poop.
Which is going to make it even harder to lose the weight that you already gained from coronavirus and from transition hormones. All right. Yeah. So 2 takeaways that I've heard that I want to make sure that we repeat. One, if you go to a conventional doctor and you get hormones, you must make sure that you're getting progesterone along with your estrogen, because you could be setting yourself up for lots of dangerous situations. Aside from the fact that you should, you know, make sure that you're going to a practitioner who knows how to tweak hormones and has that ability. But first thing is, you making sure that if you are prescribed hormones, make sure if you're getting estrogen, you are getting progesterone, because again, that can put you in a very dangerous situation. And two, you must poop in order to make sure that you're eliminating whatever your body needs to eliminate so that your hormones can be balanced and utilized properly. Otherwise, again, you can be setting yourself up for a dangerous situation, and your body might try to protect yourself and increase your fat because that's where it'll be stored. So there's that. The question was asked, what if you can't take hormone therapy because of a history of breast cancer?
Yeah, good question. Then you can't take hormone therapy. But my go-to would be, I won't name the herbs, but there are herbs that are not phytoestrogenic, meaning estrogen mimicking, that are out there, that are available, that might help symptoms depending on what a woman's experiencing. It is something you have to consider. Obviously, in women with histories of estrogen dominant or estrogen receptor positive or even progesterone receptor positive cancers, hormones really aren't an option. But there are herbs. We have plant friends, lots of them, that can help. So there's help out there.
Also, if your testosterone is still low, you can still get testosterone. And then if like vaginal dryness, because that's something that's treated specifically with like estrogen suppositories or creams, is off, there are practitioners who, or like what I'll say is compounding pharmacies who can work with practitioners to come up with like non-hormonal blends. I've used them myself on patients before. And they have seen results with those. It's obviously not the same as adding estrogen back to those tissues, but it is symptom relief. And then making sure, I believe Dr. Khadija said earlier, making sure the thyroid is well balanced and kind of the rest of the HPA axis is doing what it needs to do can also be beneficial. But yeah, I second no hormones, unfortunately.
What is HPA axis?
It's the hypothalamic pituitary adrenal axis. So it is making sure that your stress is lowered, like we talked about earlier, with dealing with those adrenal glands. They sit on top of the kidneys and they release your sex hormones, but also your stress hormones. Making sure that thyroid is doing what it needs to. So energy is where it needs to be. Mood is balanced. If weight gain is an issue, then that's being taken care of. But you do have to look at, our naturopathic way is looking at you as a whole person. And although you're going through menopause, you have a bunch of other things that can also be happening at the same time. And so trying to give as much symptom relief as possible and making the rest of you as healthy as possible is always the goal, I feel.
And that is a huge goal in naturopathic medicine. So I was actually telling people just yesterday that I am not opposed to writing prescriptions. I am not opposed to medications. If you need a medication, whatever that is, blood pressure, blood sugar, hormones, if you need it, use it, but don't stop there, because there are other things in your body, in your system, that can be balanced, that can be healed, that can be worked on, so that you are, so that you could potentially not need the medication. Or if you use the medication, you might use less of it. Or if you use the medication, you're not necessarily going to have to increase your dose of that medication over time, because your body is actually working better the way that it's supposed to. So not all naturopaths are against medication, but generally we will not stop at the medication, as was mentioned. Anything else? What'd you say, Dr.?
I'm glad you said that, Dr. Turshá, because so many people think that we are completely anti-medication, and it's like, no, ma'am. If I need to put you on amlodipine, you're going to get on amlodipine. That's just what we're going to do until we can correct all the other imbalances to wean you off, to get you to lower dose, or whatever it is. So I appreciate you putting that little insert beep. We are not opposed.
Thank you. For the people who are not, okay, let me re-ask this question. There are people who are watching the video and who will watch the video who may want to contact one of you. Do they have to come into your office in order for you to fully work with them, or can you prescribe a compounded hormone blend for someone who's not living in your state? Can you do telemedicine with that person and prescribe for them?
So where I am in Pennsylvania, we actually do not have a full scope yet in terms of what we can do. So I actually don't prescribe. I do a lot of my hormone stuff is herbs, like plant friends are my jam. And that's how I help women get through this phase in their life. So I still work with them virtually. I still do custom formulas for them, but plant friends are the way that I'm helping my females transition through this beautiful time in their life. So telemedicine, virtual, yes, they don't have to come in. We can still run labs. I still send you to your local Quest or whatever's in your neighborhood. I have patients all along the Eastern Seaboard and going down south. So not an option to get the help that you need. That's Khadija.
Excellent.
A lot of it depends on the scope of the state, as Dr. Khadija said. So in Arizona, I do have prescribing rights. You would have to be based in Arizona for me to prescribe. And a lot of the naturopaths here as well, just because you have to hold a license in whatever state, which I feel like is a whole nother webinar. But anyways, outside of Arizona, any patient or client that I'm helping in that way, it would be utilizing herbs. Okay. If you're in the same state, then we can compound and do bioidenticals if all those risk factors aren't there.
Okay, thank you. Thank you.
Same. I live and practice in Washington State and can prescribe and do. I do work with people all over the country and work with menopausal women using herbs at this time. But my Washington-based patients, we can go the full scope.
Okay. One last question before we wrap it up. Someone actually sent me this question earlier this week. She said, I got a transvaginal ultrasound back. The lining of my uterus got thicker. Last period was 9 years ago. Can anything be done about that? Now, I know that this is not necessarily a quick, a thing that can be answered quickly in depth, but I wanted to make sure that I addressed it because that is one of the things that, needs to be checked as she goes through like perimenopause, menopause, and then beyond. If her uterus changes, if she starts to have cycles or anything like that, can anything be done for that? Or what can she, what questions can she ask? What advice can be given to her?
I think Dr. Brandi was saying earlier that monitoring is extremely important. And so monitoring hormone levels in using blood or urine is critical. Also monitoring changes to these tissues like this woman is inquiring about. So making sure that she's getting regular mammograms to make sure that her breasts the tissue isn't changing as a result of being on hormone replacement, getting ultrasound, pelvic and transvaginal ultrasounds that can tell us if the lining of the endometrium is changing. And so in this case, she probably wants to see a gynecologist to make sure that there's not a more serious reason for that occurring. And also speak with, if she's on hormones, it's not clear if she is or not, that she speak with her prescriber about these changes and figure out what steps need to happen to get that to stop happening.
Thank you. Anyone else?
I agree, especially if there's bleeding, then it's biopsy time. Someone needs to, the transvaginal ultrasound showing a thickening of the lining. Last period was 9 years ago, or last cycle. So even hormone replacement or not, making sure that there's not a reason, because that shouldn't be happening considering the lining's not shedding anymore. And sometimes that can mean that there's something else that's secreting hormones that doesn't need to be there. And so it would be a referral to gynecology. Whoever did the ultrasound, I'm also assuming, would do a biopsy next. And then once that's done, then they can kind of say, okay, yes, there's something we need to look further into, or we can ablate the tissue and be done with it. Just kind of depends.
All right. Thank you. Let's go ahead and wrap up. If you all, well, not if, you all have one last thing that you want to make sure that people, the people listening, the people watching, get from this message, what would that be? Let's start with Dr. Karen.
Yeah, I guess my take on women's health in general, and particularly this passage from perimenopause to menopause, is that we got to stop pathologizing it. I mean, this is, women's bodies change from puberty on. Like, this is part of the deal when you show up in a female human body. And so reaching out, I guess my message would be to your listeners, your viewers, and to anyone who works with us, is that there's nothing wrong with you, and there's help, and there is power on the other side of this, and just know that it's true, and it's going to happen for you. But please do reach out to us. We can help with you getting there. It's a step-by-step process. It's not an overnight fix, and really, you're perfect, just as you are.
Dr. Brandi.
I feel like from a lot of what we said is to be patient with yourself, to be compassionate, and to empathize with yourself. Like, yes, you're going through something. Reach out to the women in your life. Reach out to, the physicians. Reach out to therapists. Get what you need to get so that you can be the best version of yourself possible. And your best years aren't behind you. I feel like that's a thing. Like, your body's not what it used to be. Your mood isn't the best years aren't behind you. It's kind of what you do with it. Like, the ball's in your court. Take your health into your own hands, but be gentle and know you're going through something. It is common. It does happen. And like Dr. Karen said, you're going to make it through, and it'll be great.
Thank you. Dr. Khadija.
I would say seek help early so that we can help you make this an enjoyable process to get to know the new you, because your body's changing again. So welcome and be happy for the new you. Let one of us or someone in our field help you enjoy that versus it being a dreadful thing, because it's a beautiful thing. Like Dr. Karen was saying, Dr. Brandi said, like, I wasn't cursed, but you're a bomb. I'm trying to watch my lane. You're a bomb female. Embrace that. And one of us can help you transition so that journey is not dreadful. So yeah.
Real quick, how early should someone begin seeking care?
I believe Dr. Karen said at the beginning, women start to transition perimenopause around late 30s. So I would say it's never too early. Even if you set an appointment up, kind of get maybe baseline labs, see where you are, what symptoms are you experiencing, and then start. I feel like it's never too early to start talking or having that discussion. When did your mom go through it? And then kind of figure out your game plan.
Thank you. Dr. Farr.
Never too late to, make better habits. It's never too late to be the best you can be, right? So, a lot of people say, well, you can't teach an old dog new tricks, but you know, I've seen people transform even like their late 50s, 60s, 70s. It's possible, you know?
Yeah.
And what we do as holistic doctors, like we really look at everything, right? Like we look at the mind, the body, the soul. It's not just physical. It's like, okay, yes, we get your hormones are changing, but also, well, let's see like what in your lifestyle we can change, right? Or how can you help yourself prevent those environmental toxins that get into your body and increase something called your xenoestrogens, right? So, you know, a lot of people think of estrogen as this big molecule, but there's, you know, different kinds of estrogens that are metabolized in your body. So as practitioners, you know, we can help guide patients of how to lead them through a different pathway, the better, you know, beneficial estrogen pathway, rather than the one that leads into, you know, cancer and all those, you know, like bad things that happen. So really trying to get a whole body picture of someone and recognizing that they are an individual, right? So no, not everybody's like fits into a cookie cutter model. And that's the beauty of what we do. So, you know,
Yes.
Knowing that there's help, we can help them. We can really help guide them to a better life. So
Thank you.
with that, yeah.
Thank you. And for those of you who are not going through menopause, perimenopause, you have women or females in your life who either have gone through the process, are going through the process, or about to go through the process. As we mentioned earlier, just be encouraging, being supportive. Remember what puberty felt like, and just think about that, multiply that. Because, you know, depending on how she's sort of lived life and prepared her body, that is sort of what's going on. So be very supportive, you know, find out her love language, find out how to encourage, and, you know, just be that person, be that support person for her. Now, we've typed up the names and contact information for each of the docs, but I want you guys to actually speak it. Tell people how they can contact you. Dr. Hurley, Dr. Karen?
Yes, drkarenhurley.com. That's my website. Best way to find me is there. Book an appointment for a free consult. I'd love to talk to you.
Excellent. Thank you very much. Dr. Brandi?
Instagram is a really easy way to get a hold of me, and that's just at Dr. Brandi, that's Dr. Dr. Brandi _ N as in Nancy, M as in Mary, D as in David.
Thank you. Dr. Khadija?
So you can find us online on our website, www.myinfinitewellness.net, or Instagram. I like to hang out there at myinfinitewellness.
Thank you. And Dr. Farr?
Yes, so I'm going to be accepting clients pretty soon on telehealth, so on my website. Mine is pretty easy to remember, facebook.com/Dr. Farr, instagram.com/Dr. Farr, or dr-farr.com. So stay tuned and excited to be working with new people.
Excellent. And I am at Dr. Turshá on all social medias. That's DrTursha. You can reach me through my website, drturshá.com, DrTursha. And don't forget to follow NDs of Color on both Facebook and Instagram at NDs of Color. And we will be back next week for another topic. Be sure to let us know if there is a topic that you have questions about, that you are interested in. Let us know, and we will do our best to put a panel together of experts in that area to share information with you. And make sure you reach out to these awesome docs, because they have the knowledge that you may have been looking for. They can work with your conventional doctor. They can work alone. They're nice people. Just talk to them, call them, holla at them, follow them on all the social medias, and, you know, get the information that you need, get the empowerment that you need, because we all need support, and these are great additions to your healthcare team. We will see you next week. Thank you for joining us. Oh, Dr. Khadija has one more thing.
One more thing. I believe all of us, we agreed that we were going to dedicate this call to the late, great Chadwick Bozeman. So rest in power, King. There we go.
Yes, Wakanda forever. Wakanda forever. Thank you for the reminder. Take care, y'all.
Thank you, Dr. Turshá.
Thanks, everybody.
Thank you. Bye.